Dear viewers, this video is part 1 in the two-part series on alcohol use disorders. For the other video and the related basic functions of the liver, see Prescribon Medical Education series. Alcohol use disorders. World burden of alcohol use. Worldwide, 3 million deaths every year result from harmful use of alcohol. This represents 5% of all deaths. Overall, 5% of the global burden of disease and injury is attributable to alcohol. Alcohol use disorders, AUDS, commonly known as alcoholism. Definition: when a person has uncontrolled and problematic drinking. It is estimated that globally around 1.4% of the population have an alcohol use disorder. These people exhibit impaired control over their alcohol consumption and exhibit a chronic, heavy, and often escalating pattern of alcohol use, despite significant detrimental consequences to their overall health, the lives of their family members and friends, and to society in general. Dear viewers, by the way, this educational video is made possible by Prescribon, the makers of e-prescription software for digital prescriptions available freely for doctors on the website www.prescribon.com. Doctors who are interested in this e-prescription can freely avail of its vast collection of more than 100,000 e-prescriptions. Now, coming back to the subject, alcohol or ethanol has diverse and widespread effects on the body. It impacts directly or indirectly on almost every neurochemical system in the brain. This drug, yes, a drug indeed, can exacerbate most medical problems. It affects medications metabolized in the liver. At higher doses, it can temporarily mimic many medical problems, example, diabetes and psychiatric conditions like depression. The lifetime risk for repetitive serious alcohol problems in patients is at least 20% for men and 10% for women. In US alone, the medical costs for these problems exceed $249 billion. Chronic alcoholics suffer significant morbidity and have a shortened lifespan related principally to damage to the liver, gastrointestinal tract, central nervous system, cardiovascular system, and pancreas. Alcohol use disorders decrease the lifespan by about 10 years. Pharmacology and nutritional impact of ethanol. Ethanol blood levels are expressed as milligrams or grams of ethanol per deciliter. 100 milligram per deciliter equivalent to 0.1 gram per deciliter. One typical drink, blood level rise of around 0.02 gram or 20 milligram per deciliter, resulting from the ingestion of a standard drink is 10 to 12 gram of ethanol, its equivalents 340 ml 12 ounces of beer, 115 ml 4 ounces of non-fortified wine, and 43 ml about 1.5 ounces a shot of 80 proof, that is 40% ethanol by volume. It's the beverage called, example, whiskey. 0.5 liters, 1 pint of 80 proof beverage contains around 160 gram of ethanol, that is 16 standard drinks. 750 ml of wine contains around 60 gram of ethanol. Congeners. These beverages also have additional components called congeners that affect the drink's taste and might contribute to adverse effects on the body. Note: congeners are minor compounds other than ethanol that occur naturally in alcohol beverages as a result of distilling and fermenting processes. Congeners include methanol, butanol, acetaldehyde, histamine, tannins, iron, and lead. Alcohol dilemma. To abstain from drinking moderately or no drinking at all. What to do? Countless scientific studies have encouraged the idea that a glass of red wine a day can be good for the heart. Unfortunately, this is not true at all. The safest level of drinking is none. This zero level is in conflict with most health guidelines, which espouse health benefits associated with consuming up to 2 drinks per day. A large new global study published in the Lancet, published on 23/8/2018, reference is shown, has confirmed previous research which has shown that there is no safe level of alcohol consumption. The researchers admit moderate drinking may protect against heart disease, but found that the risk of cancer and other diseases outweighs these protections. They found that out of 100,000 non-drinkers, 914 people would develop an alcohol-related health problem such as cancer or suffer an injury. But an extra 4 people would be affected if they drank one alcoholic drink per day. But an extra 63 more people would be affected if they drank 2 alcoholic drinks a day. But a further extra 338 people more would be affected if they drank 5 alcoholic drinks a day. 1 drink a day does represent a small increased risk, but adjust that to the whole population and it represents a far bigger number, and most people are not drinking just 1 drink a day. Previous studies have found a protective effect of alcohol on some conditions, but we found that the combined health risks associated with alcohol increases with any amount of alcohol. The strong association between alcohol consumption and the risk of cancer, injuries, and infectious diseases offset the protective effects for the heart disease in our study. Although the health risks associated with alcohol start off being small with 1 drink a day, they then rise rapidly as people drink more. Moderate drinking may safeguard people against heart disease, but the potential to develop diseases, driving accidents, self-harm, and cancer greatly offsets these benefits. About 5% of cancers are linked to alcohol. Alcohol led to 2.8 million deaths in 2016. It was the leading risk factor for diseases worldwide. The more people drink, the higher their risk of alcohol-related health problems. Present recommendations, so-called recommendations. Alcohol intake should not exceed 3 units, that is 30 grams per day in men, and 2 units, 20 grams per day in women, and should be further limited or avoided in those with hypertension or obesity. Alcohol contains 7 calories per gram. Beers and wines in particular can be fattening. So-called diabetic beers, low in sugar but strong in alcohol and spirits, with sugar-free mixers are especially likely to provoke hypoglycemia. Alcohol is a depressant drug, hence it decreases neuronal activity. It has similar behavioral effects as other depressants including benzodiazepines and barbiturate. Benzodiazepines, a class of drugs used to treat anxiety, epilepsy, and insomnia. Barbiturates, a group of nervous system depressants which produce sedation. Alcohol is absorbed from mucous membrane of the mouth and esophagus in small amounts, from the stomach and large bowel in modest amounts, and from small intestine in large amounts. The rate of absorption is increased by the absence of proteins, fats, or carbohydrates which interfere with absorption. Alcohol-related traffic fatalities and injuries. There are 1.25 million annual road fatalities worldwide. An average of 22% among road deaths are alcohol related. The alcohol related deaths among fatally injured road users can be put at around 273,000 people every year. There are indications, however, that this number underestimates the problem. As a result, the actual number of alcohol related fatalities is probably higher still. Serious injuries are even more prone to underreporting. Indian scenario. In 2020, road crashes in India claimed about 1.3 lakh lives and caused injuries to more than 3.4 lakh people. Drunk while intoxicated, DWI. Such incidents cause almost one third of all traffic accidents and are considered to be among the most serious of driving offences. As per the national statistics, an average of nearly 12,000 people die every year and an average of 9 lakh people get arrested in drunk while intoxicated incidents. So, drink and don't drive is advice that should be followed implicitly. This diagram shows the metabolism of alcohol in the body, mainly in the liver. 20% of alcohol is converted to acetaldehyde in the smooth endoplasmic reticulum in liver cells, and 80% is converted to acetaldehyde in cytosol of cells. Acetaldehyde is converted into acetyl coenzyme A and to fatty acids and into acetate to carbon dioxide in water. Only 2 to 10% of alcohol is excreted directly through lungs, urine, and sweat. Metabolism of alcohol. See the earlier figure shown, alcohol metabolism. Most alcohol, 80%, is metabolized to acetaldehyde primarily in the liver. The most important pathway occurs in the cell cytosol where alcohol dehydrogenase produces acetaldehyde, which is then rapidly destroyed by aldehyde dehydrogenase in the cytosol and mitochondria. A second pathway occurs in the microsomes of the smooth endoplasmic reticulum, the microsomal ethanol oxidizing system that is responsible for around 10% of ethanol oxidation. Between 2 and 10% of ethanol is excreted directly through the lungs, urine, or sweat. Alcohol amounts in standard terms. A standard drink contains 70 to 100 kcal of energy. A standard drink increases blood concentration by 0.02 grams per deciliter, that is 20 milligram per deciliter. However, it is completely lacking in essential minerals, proteins, and vitamins. In fact, alcohol interferes with absorption of vitamins in the small intestine. Alcohol decreases storage of vitamins in the liver with modest effects on folate, that is folacin or folic acid, pyridoxine B6, thiamine B1, nicotinic acid B3, and vitamin A. So, dear viewers, this is the end of part 1 in the two-part series on alcohol use disorders. For part 2, see Prescribon Medical Education series, Alcohol Use Disorders, part 2.